Hello everyone and welcome back to MediInsights. If you or someone you care for is facing nausea after chemotherapy or surgery, this quick episode on Aprepitant Capsule will explain what it does, how to take it safely, and the key things to watch for. Starting with use of Aprepitant Capsule. Aprepitant is an antiemetic used mainly to prevent chemotherapy-induced nausea and vomiting, including both the early and delayed phases, and it is also approved to reduce postoperative nausea and vomiting. It is commonly given with another antiemetic such as a 5-HT3 antagonist and a steroid for best effect, because the drugs work on different pathways. Aprepitant can greatly reduce the need for rescue medicines after highly emetogenic chemotherapy. Next, Dosage of Aprepitant Capsule. For adults receiving chemotherapy, the typical oral regimen is 125 mg 1 hour before chemotherapy on day 1, followed by 80 mg once daily on days 2 and 3, though your oncology team will choose the exact schedule based on your regimen. For preventing nausea after surgery, a single 40 mg dose given before anesthesia is the commonly recommended option. Children have weight-based dosing, and a suspension form is used for those who cannot swallow capsules, so let a pediatric specialist set the dose. Always follow the exact instructions from the prescribing clinician. Next, mechanism of action of Aprepitant Capsule. Aprepitant works by blocking neurokinin 1 receptors and preventing substance P from activating the vomiting center in the brain, which is why it is especially effective for the delayed phase of chemotherapy nausea. It does not act on serotonin 5-HT3 receptors, so when combined with 5-HT3 antagonists and dexamethasone, the three-drug approach covers multiple emetic pathways. That complementary action is the rationale for its use in many antiemetic protocols. Next, side effects of Aprepitant Capsule. The most commonly reported adverse effects are fatigue, diarrhea, hiccups, and mild abdominal discomfort, and occasional changes in liver enzymes have been seen, so your team may check blood tests when needed. Serious reactions are uncommon, but if you notice severe abdominal pain, yellowing of the skin or eyes, or signs of infection, seek medical care promptly. Also be aware that some people report dizziness or low energy after taking the drug. Next, important advices for using Aprepitant Capsule. Tell your doctor about all medicines you take, because Aprepitant affects drug-metabolizing enzymes and can reduce the effectiveness of hormonal contraceptives and change warfarin levels, so extra contraceptive measures and INR monitoring may be needed. Your clinician may adjust doses of dexamethasone or other drugs when used together with Aprepitant because of CYP3A4 interactions, and strong enzyme inducers like rifampin can lower Aprepitant levels. If you have severe liver impairment, pregnancy, or breastfeeding questions, discuss risks and alternatives with your prescriber before taking Aprepitant. Thank you for watching this short MediInsights guide to Aprepitant Capsule. And if this helped you understand when and how it's used, please tell us your questions or experiences in the comments below so we can cover them next. Check the video description for trusted links, dosing references, and sources your clinician will rely on.